Hi everyone, this is Tom Mose again at DFSS. Just want to let you know the first presenter is about to begin. And as we go through the PowerPoint, we just want to remind you to please type in your questions. It's the screen you'll see on the right-hand side. And when we get to the Q&A, after about 30 minutes, we're going to reserve 30 minutes to answer your questions, and we can have a great back and forth discussion with you. So thanks again for all that attending, and we'll start right now.
Thank you for joining us today. This is Rima Mohofer from DFSS.
Hello, everyone. Apologies for the no sound. We're going to go ahead and begin again, okay? Thank you.
Thank you for joining us today. This is Rima Mohofer from DFSS. Welcome to the webinar on the overview of Chicago Early Learning Standards First 45 Days. The final revision of the standards, dated August 2017, was sent to all agencies last week in the CSC update. Today, we will provide a brief overview of the Chicago Early Learning Standards and lay out the plan for the in-person Train the Trainer session. So the purpose of this webinar is to brief agencies on the upcoming implementation manual training and the priorities for the first 45 days of operation. We're going to move through the slides, and you'll have an opportunity to hear from content area specialists on such things as collaborative governance and ERC and health and so on. And then at the end, you'll have a chance to have a Q&A. So over the past year, many of you have participated in the development of Chicago Early Learning Standards. We have spent many months combining and refining the best practices and requirements for all Chicago Early Learning programs. After an iterative revision process, including input from representatives from your agencies, we have a complete approved manual. Thank you for your collaborative spirit, your questions, and your patience through this process. Although the initial phase of compiling these standards into one guide is complete, we want you to know that we will continuously improve and refine this manual as we live with the document. Please know that as we continue to clarify how these standards are implemented, the language may change, and hopefully the practice of these standards will become more clear. And before we move on, I'm going to go through our training goal and learning objectives. So our goal is to provide comprehensive, high-quality early learning services to children and their families in order to impact children's learning and development. Our objectives are to deepen knowledge of all Chicago Early Learning Standards, understand what the program expectations are in the first 45 days of program service, and enable effective monitoring of program services. Our next step in the training approach is to work with you and your agencies to assist you in the rollout of standards with your staff in a train-the-training model. Many of you, in the train-the-trainers model, many of you may have shared some version of the manual with your staff as part of the feedback process. We would like to help you formalize your planning process for rollout of this standard. Therefore, over the next 2 months, we'll be inviting you to a process where you will have the opportunity to develop a training plan for your staff. We expect the 2 staff members from each agency to come to each of the Train the Trainer sessions. At these sessions, they will have the opportunity to work with DFSS staff and their colleagues to develop the agency plan for training staff members on the content of the standards. The participants will be given sample PowerPoints that can be revised to fit each program's uniqueness. They'll be given resources for group engagement around the material, FAQs to use with staff, and a template for a training plan. You will have DFSS staff to bounce ideas off of and to clarify the requirements. This will be protected time for your team to think about and plan how to communicate and train your agency staff. The tentative training dates and structure are that on or about October 30th, 31st, there'll be a 1-day-long session for programs that receive Preschool for All and Prevention Initiative funding only. The week of November 6th, 2-day-long sessions for single-site programs. And the week of November 13th, 3-day-long sessions for multi-site programs. And now Denise Jordan will review education.
Thank you, Rima. Now, and with respect to the education content area, education services, and the 45 days, one of the things we'd like you to know is make sure that the daily activities are individualized and directed and child-initiated activities. That lesson plans are executed weekly in all classrooms, and that teaching teams must designate a regular time to develop and evaluate on a weekly basis. We should also look at classrooms and socialization spaces as being age appropriate, meaning that equipment, materials, and supplies should be age appropriate and according to children's interests and development. We should also look at communicating with parents to take place throughout the program year, not just the 2 times a year when we do parent-teacher conferences. Also, if parents do not speak the language, the home language of the child in the classroom, they should provide support throughout the classroom with respect to materials, translators, or any type of community resources. Next, when we talk about curriculum, an agency may choose one of the following home visiting curriculums. This is in respect with preventive initiative. You have baby talk, parents as teachers, healthy families, and nurse and family partnership. For Head Start, for that for the home visiting piece, you have parents as teachers is our required model for the home visitors. Language, when it comes to language, for PI and PFA, when the children or families speak a language and speak a language in the home other than English, the English proficiency screener must be administered within 30 days. For Head Start and Early Head Start, the home language survey from Teacher Strategies Goal will be used for children who are dual language learners. For PFA, programs are required to have a bilingual endorsed teacher to serve English as a second language learner. Now, in order for us to help to build relationships with infants, children, and families, we're looking for your child and family classroom relationships to be built on through the use of home visits, orientations, newsletters, and classroom observations. Now, with respect to documentation, at the beginning of the program year, education coordinators and the managers as well may make use of daily resources from Part 1 in the Fidelity tool, as well as the Fidelity Operation Observations and Daily Structure Part 2. make sure that those are completed within the 45 days. And making sure that My Teaching Strategies child data is entered in Teaching Strategies goals. We also look at parent surveys and any teacher observations as far as documentation to make sure that it's all completed. Now let's talk about disability services and those things that are required for the first 45 days. The first thing that we really want you to know is that all children, that is all children, including those children returning with IFSPs and IEPs, must have a developmental screening within 45 days. Again, I just want to repeat, even though they have an IFSP or IEP, they still must be screened. And all rescreens must be completed within 6 to 8 weeks from that initial screening. So all children who are suspected identified with disabilities and their families, we are looking for them to have services delivered in the least restrictive environments as possible. Staff should know and understand the child's language and culture and have sufficient skill level in the child's home language to administer that screening. However, if there is not a qualified bilingual staff in the classroom, the screening can be conducted in English, but information must be gathered from the child's family as well. For us to ensure that we include children and families with disabilities in our program, in the beginning of the year, make sure you reach out to those agencies serving special needs families to provide the educational services needed. We also need to collaborate with staff to ensure that all IFSPs and IEPs are being followed and practiced and also aligned with My Teaching Strategy. Please review all screenings to make sure that referrals are made, conduct appropriate training with staff, and also work with the Early Intervention, Erickson Institute and CPS to monitor the child referral process. That ends the services for disabilities and education, and next we will have Elaine Millsap-Parker, who will talk about other content areas.
Thank you, Denise. We will now talk about transportation services. As you will see, these 3 bullet points are found in the Chicago Early Learning Implementation Standards, and we encourage you to look back at those standards, where it talks about training must occur before any bus riding occurs, the release of children only to persons that are on that consent list, and programs must adhere to the child's IFSP or IEP transportation policy. These are things that you should also focus on within the first 30 days of the program year. You need to make sure that you have conducted your transportation and pedestrian safety training for children and parents, and make sure that you have scheduled a bus evacuation drill with buses or vended bus companies, and submit that documentation in COPA by the 2nd Friday of November. Sharita Webb will now present on her content area.
Thank you, Elaine, for introducing me. I'm Sharita Webb, and today we'll be talking about family engagement and community partnerships on the first 45-day priority. This slide has a lot of information on it. I just want to point out a couple of items that are of importance to us. The second bullet, as it relates to family assessments and partnership agreements. With family assessments, those need to be done at enrollment or during the enrollment process with the parent. The partnership agreement needs to be introduced to the parents. Ask them if they would like to complete one. If they're not ready to complete a partnership agreement with you, that's okay. You will definitely have an opportunity to talk to the parents again and ask them if they would like to enter into a partnership agreement with you all. Also, just looking at the third bullet as it relates to the ratio of families. At this point, DFSS is recommending a ratio of 1 to 40 families per FSW in early Head Start and Head Start. Also note, your requirements for early Head Start Child Care Partnership is a ratio for 1 to 40, and your PI ratio is 1 to 36. Soon we will be introducing our parents as teachers and Baby Talk as our research-based curriculum. We will have more trainings as that comes up. And any other curriculum that you all are using, it must be approved by DFSS as it relates to the parent engagement curriculum. Some of the first 45-day requirements should be conduct your first home visit with the teaching staff as needed. Also talk to your parents about the goals. As I stated before, create a partnership agreement if needed. You document all this information in COPA and also case notes in COPA. At this time, you can make referrals and conduct any services as needed and document this information in COPA. One thing to keep in mind that on November 15th, by November 15th, at least 50% of your families should have at least one service completed. Also implement the parent orientation and share the handbook with your parents. I'll also be talking about health services as it relates to the first 45 days. We all know that school readiness begins with health. Some important changes that we made this year would be our toothbrushing with fluoride for all children with teeth, and that is to be done at least once a day. As a health insurance option to the change, please make sure you assist families to be able to access health care. Within the first 45 days, or actually in enrollment, each child must have a physical in all program options. But for home visiting children, within 90 days of enrollment, the children must have a completed physical. The physicals must not be more than 6 months old. Also, within 45 days, please obtain dental exams for Head Start and early Head Start children. We will conduct vision and hearing screenings within the first 45 days, and please monitor and follow up on any missing medical information, immunizations, dental within the first 45 days as well. Within the beginning of the year, which is within the first 45 days, we also have to think about safety practices in our systems to keep the families, the staff, and the children safe. So think about developing your policies and procedures and training as it relates to cyber-ring, hand washing, things of that nature. Also think about your systems that include monitoring and also analyzing your data on accidents and incidents and injuries. Make sure for facilities that you conduct a general inspection of your sites. Make sure that the sites are inviting. So at least daily or weekly, and these daily, you must complete a health and safety, a health check on the children every day. You also have to have your health and safety checklist and report any issues immediately to DFSS. Monthly, conduct your fire drills, complete your playground equipment checklist, replenish first aid kits and supplies. And also make sure when you all are out walking with the children, taking them to the park because it's such a nice weather outside, make sure that you monitor and check the playground at the park before the children enter them. Nutrition services within the first 45 days. Make sure that you guys check the child's nutritional status. That's pretty much in the beginning, the health history, and the health history. Make sure that all your meals are healthy and safe. Please use your child and adult care food program funds. And and make sure you are in compliance with your child and adult care food contract. Again, as we talked about services in the family engagement piece, you can support families who need additional nutritional resources such as WIC or SNAP benefits. That could be one of the services that you help a family with. And understanding your community nutritional needs and resources. So as I stated before, complete your nutrition assessments, document in COPA, make a plan if necessary. Verify that you have a contract with your nutrition consultant. This is for Head Start and Early Head Start. Make sure that you guys plan with your nutrition consultant for training. Make sure all your growth assessments are completed and documented in COPA. Most of the times you use the growth assessments off the physical for your first growth assessment documentation. Make sure your USDA contract is in great standing or good standing. Plan and post your menus after nutritionists and the parents review them. Make sure your menus are posted and up to date. And if you have to substitute anything for that day, make sure that you post the substitute menu. And please plan and conduct the first classroom food experience. Mental health and well-being, the first 45-day priorities. All agencies must implement an environment of attitudes and behaviors of well-being throughout the program. Pretty much saying all programs must have a warm and inviting program. Early Head Start and Head Start must develop your contracts with a qualified mental health providers and submit the completed contracts to DFSS. Just the back portion, we do not need the entire scope of service or the cooperative agreement. Make sure your documentation is entered into COPA. That will be coming soon, where you can scan this information into COPA. Your mental health consultants, make sure that they're licensed and certified. Check the CELS, Chicago Early Learning Manual, and it will provide you with the requirements and the qualifications of the mental health consultant. PI, the continuity and relationship model should be implemented in all classrooms in order to sustain teacher and child well-being. So within the first 45 days, make sure you conduct your social emotional screening. We are using the ASQ as H2. Follow up on any referrals from the assessment at this time. Scheduling these staffing, make referrals to your mental health consultant. Make sure you have had your mental health planning meeting with the mental health consultant and your families. Plan for your workshops for staff and families. Conduct any mental health classroom observations as needed, and please complete your mental health activity record. This concludes my portion of the webinar. Elaine Millsap-Parker will speak next on additional content areas.
Thank you, Sharita. As a reminder, we will take and respond to questions at the end. If you haven't done so already, please begin typing your questions. So I'm going to speak briefly about URSEA and program structures for the first 45-day priorities. I want to take your attention to bullet point number 6, regarding programs need to work with the child, family, and DFSS before a child is expelled or suspended from the program. I want to make sure that you also include your mental health consultant in this process, as well as including them in the process for developing your exposure policy as well. Some other items that you need to pay attention to within these first 45 days is to make sure that all your information is entered into COPA accurately and in a timely manner. Make sure that the age and class size is in compliance and that is prioritized. We also want to make sure that your income eligibility documentation is maintained and is on file, as well as for your verification of income eligibility. Make sure that the checklist is completed and that you have obtained parent signatures. And we also want you to be mindful of the attendance policy as it relates to documenting and following up on children who may not make it to the program within the hour of your start time. A few words on collaborative governance. I want to call your attention to bullet point number 4, and just remind you that Policy Council and Policy Committee members must be elected or re-elected annually to serve at least 1-year term, which is not to exceed a number of 5 years. And you must have a tracking system in place to document their years of service. Some additional 45-day priorities for collaborative governance. By now, you should have already conducted your parent orientations as well as some of your policy committee orientations, making sure that you cover their leadership roles and the expectations to serve either on policy council or on policy committee. You want to make sure that you have a nomination process in place. You want to keep this information documented, as well as documentation of the election process for policy committee membership, for the officers, and for your community reps and your citywide parent policy council reps. Make sure that you have provided training to the policy committee and for the board. For the policy committee, you want to make sure that you go over their leadership roles for officers. You want to go over the program governance policies and procedures that govern them, such as their bylaws and the child care reimbursement policy. You also want to provide them with meeting decorum training, that's parliamentary procedures, how to make a motion, how to conduct the business, and revisit the Head Start performance standards. For the board, you want to make sure that you follow the board's orientation process and include some of these trainings as well between now and the end of the calendar year. Between this month and next month, you will be developing and approving the scope of services document. This is where your parent activity budget calendar comes in. You want to make sure that you have your outcomes listed and the justification for that activity. And make sure that you submit your board membership list with the required areas of expertise. Those board members who have a background in early childhood development, fiscal and accounting, a licensed attorney, familiar with the issues that's brought before the board, and a current or former Head Start parent. During this time, the board and the policy committee will also approve the FY 2017 Head Start Early Head Start budget modification. So if you need to make revisions to your budget by the end of the fiscal year, which is November 30th, please be mindful that these have to be approved by your governing body. There are 2 documents that are due to the department on November the 30th, and that's your Citywide Parent Policy Council letter of certification, which tells us who your parent reps are to the council, and the policy committee membership list, which verifies for us that you have an established policy committee. And also submit your parent and policy committee tracking form. Just a brief reminder about program management and continuous improvement for within these first 45 days. Make sure that as part of your internal monitoring process that you are reviewing your action plan that you submitted with your grant application to begin monitoring your progress on those goals and objectives and those action steps that you will take going into the new program and fiscal year. You want to make sure that your communication protocols are in place for the meetings with your staff, with your parents and your boards, and make sure that you are maintaining evidence of these meetings and trainings. We also want to make sure that all staff who have been hired as of November 7, 2016, that they meet the qualifications as indicated in the Head Start performance standards. We want to make sure that all staff are hired and their background checks are completed and that their professional development plans are completed as well. So this concludes our presentation, and we will now take your questions.
So your upcoming COPA trainers will be held in preparation for the release of the enrollment and HR manual. And also, COPA site-based access meetings will be held on October 30th and October 31st. So just make sure you look for that, more of that information in your CSD update. So, our Q&A, but just for you to know that on the right side of this webinar, the PowerPoint is going to be there, and it's in a PDF form, and you'll be able to get that. So also now we're going to be looking at your questions to see if we can answer them during this Q&A session. And if for some reason we don't have time to get to all of your questions, we'll make sure we download those questions and then be able to respond to all of you with regard to your answers and any other issues that you may come up with. All right. Questions?
Are you stating that a child with an IEP or IFSP must be screened using the EZR and ASQ3?
Yes.
Is our referral process for PFA the same as before when we were under CPS?
We will have to get back to you on that. And please, I just need a little more information about what referral process. So if you can give us a little more information, we'll definitely get back to you on that. For children who are PFA but not Head Start, how are we supposed to follow up with referrals? So previously stated, we will get back to you on that.
This is Elaine, and the question is, where in COPA do we upload bus evacuations? So right now, you're going to continue to follow the process that you have been doing to submit your bus evacuations until we give you instructions on where that will be uploaded into COPA eDocs.
This is Sharita. What kinds of health issues are you talking about as having to report to DFSS? So if you have an outbreak at your center of a communicable disease or something like bed bugs or meningitis, anything like that, you should report that immediately to DFSS. This is Sharita speaking, but the question is, PFA or PI only programs have to do growth assessments. When we talk about growth assessments, we're talking about Head Start and early Head Start at this particular time. This is Sharita again. I thought that mental health services were going to be more flexible this year. They are more flexible this year. We still have a few core components that needs to be completed, but instead of, the biggest change that we had is that instead of you having a 15 to 19 maximum number of hours per classroom, per site that you can have with your mental health consultant, you now do not have a maximum. It is up to your center on how you want to utilize your mental health consultant's hours, besides very few core components, like if there's individual observation that needs to be handled, and then our family, not family, but staff meetings and things like that. This is Sharita again, reading the question. Do the screenings have to be entered into COPA within 45 days or just completed within 45 days and can be entered after 45 days? So I understand that question, but one of the things, we like to have real-time data. And as much as you can enter before the 45 days are done, if you have a group of kids that you have completed, all their screenings have been completed, we would like for you to enter them, because that gives us an accurate number in real-time data on where we are as it relates to the 45th day compliance.
So what we're going to do is we're going to just read off the questions without having to identify ourselves unless, one of the two speakers change between Sharita and I. This is Elaine. So we're going to move forward. What are the mental health expectations for the PI home visiting?
That is definitely something we will get back to you on. We'll take that question and make sure you get the answer.
PI is also expected to use the checklist and Head Start eligibility verification form? No. Do PFA and PI programs need a policy committee? No, I want you to answer that. No, PFA, PI programs do not have to have a policy committee. However, you should be having parent committee meetings on a monthly basis.
In terms of the family engagement, number one, the family assessment found in COPA does not need to be completed by the first 45 days in COPA for all birth to 3 PI families. I will get back to you on that as far as it relates to PI. Number two, when is the due date for PI goals? When is the due date for PI goals need to be completed for families? Is it required for each family to have a total of 3 goals? Again, because it's PI, we will definitely get back to you on that.
Should income eligibility documentation be updated, or does maintained mean kept on file from income at enrollment? So when you're enrolling a new child, that income verification information has to be maintained and kept on file so that when the monitors come out to review it, they'll be able to see that documentation. Children who are returning to Head Start, they're in their second year, if they've already been approved for enrollment and eligibility, they do not have to be, eligibility does not have to be verified for the second year.
So will it be specific training or spelled out in the new manual just for sites that operate under PFA? So we are not confused on the requirements that are in the manual for early Head Start, or home visiting. The manual has went out, and there are, it's pretty specific. It'll say PI when there's PI. It'll say for all programs when it's all programs, and it'll say Head Start, early Head Start, and child care partnership. At this time, I do not believe there will be a separate PFA training because we're all under the Chicago Early Learning Standards, but we will make sure that we spell out and differentiate during the trainings as it relates to the different program models.
So there will be, so the question is, can we get a copy of the PowerPoint presentation? And so, yes, we will provide you with a copy of the CELS webinar and the PowerPoint. Oh, it's right there. It's already there. You just click on it, and you'll have the PowerPoint presentation. But we will send it also.
I'll read the question for you. Does DFSS provide hearing and vision screenings at our location for children?
Yes, we provide hearing and vision screenings at the site location.
When will we receive information on our approved bus company?
We are currently in the process of trying to identify additional contracted transportation providers In the meantime, please continue to contact Twana Robinson, let her know what your needs are, and we will address them as soon as we have concrete information and a newly identified provider.
How can I be added to the CSD listserv to get these updates on trainings?
Go ahead, Tom.
Hi, everyone. This is Tom. I spoke in the beginning when we started the webinar. We do have the listserv, as many of you know, that we try to send out weekly updates. And depending on where, what site or agency you're with, we can try to go through that site or agency to have that person you know that receives the updates to reply to that email, and we'll try to get you on it. Otherwise, we'll when we send out our responses to these questions, we can also we can provide that email so you can respond to that with your contact information as well.
If we never used the Teaching to Fidelity tool before, how do we find out more about it?
We're in the process right now of trying to schedule some trainings in the upcoming month for Teacher Strategies, goal, assessment, all the things, even fidelity. So I'm going to say to you to reach out to your education coordinator and continue to look on Children's Services COPA for training dates, times, locations.
Can you repeat the developmental screening statement if English is the child's second language?
If English is the child's second language, you should try to have a teacher in the classroom who speaks the child's language. If not, the screening can be conducted in English, but you should also reach out to the parent or any parent volunteers who will help you to interpret that.
Will PI home base be implemented in TSG, Teaching Strategies Goal?
PI home base, we'll have to get back with you on that one because I believe you're using parents as teachers. So we will get back with you on that one. Let me write that. PI.
We do not have a bus company assigned. Will we receive something in writing stating the delay?
Okay, not sure you're going to get anything in writing stating the delay. You will get something in writing as soon as we have identified additional providers. DFSS is really aware that we don't have a bus company, but if you need something in writing talking about the fact that we are in the process of getting something, we can do that for you.
Define outbreak if we have 1 case of bed bugs or 2 or 3 cases of hand, foot, and mouth, etc. What do we report and how?
So as far as outbreak, if you have 1 case of bed bugs, we do not need to know that. When we talk about an outbreak, it's at least, and I'm going to double check this, but I'm going to say a minimum of 3 to 4 outbreaks in the same site, in the same classroom. That's what we mean by outbreak. And you can contact us, you can contact your support service coordinator, you can also contact myself, Sharita Webb. When will the HR policies reflect the new Head Start performance standards that centers have 45 days, I think, to give staff background checks?
So the HR policies and procedures that are written in the new Head Start performance standards are included in the Chicago Early Learning Implementation Manual. And so you want to read that and cross-reference it with the Head Start performance standards to make sure that your personnel policies and procedures for CRC, criminal records checks, includes this information required by Head Start.
I just wanted to say that, by the way, we are super excited that we have 75 people on average attending this webinar. And you guys are still on the line right now. Kudos to you. So we'll spend about 10 more minutes answering the questions so you all can get back to work. All that we do not answer, we will definitely get them out to you all as a Q&A, a frequently asked questions.
Did we get the new list of transportation companies we can use, or do we use the same companies we have used last year?
Okay, I'm going to state this again. For those of you who may not be aware, Illinois Student Transportation is no longer contracted with us. We are in the process of securing additional transportation providers. This process is not a quick one, but as soon as we have information, we will ensure that everyone gets it.
Where do we enter screening data and dates, case notes, etc.?
Denise, I know that it's not just in case notes, it's actually in, I can't think of the screen, but it's in education, where it says ASQSC 2 is mental health, then you have hearing and vision, which is probably under health, and then you have developmental screening, which is the ASQ3 or the EZIR, that's in COPA, but we can get a clear answer for you.
Yeah, the COPA, you're talking about the COPA report numbers. We want to make sure we get the correct numbers for you, and then we'll post it.
Yeah.
Correct report.
What's the referral process for ASQ, EZI related screenings? Specifically, what info and documentation is required?
Please read the manual, it's in there, and talk with your DSC or your CPS liaison about the actual referral process. You develop your agency's disability services coordinator has the referral process as it relates to how your agency is the one that is putting that together.
For hearing and vision, is there someone going to call the site to schedule a date?
Yes, the sites are divided by between technicians. The technicians will reach out to you to set that scheduled date and discuss the time to come out to screen your children.
What resources are you providing for helping us get home visiting up and running if we've never done that before? The manual says PFA should pilot home visiting this year. So we know that all that is in the manual, and as DFSS in our fashion has always done, is provided resources and training on how we would like for programs that have never ran before or need to be piloted. We definitely will take on that training. So as soon as it's all available, you definitely will know. Have you decided a bus company for us to use for evacuation and trip?
Again, we are in the process of identifying additional transportation providers. If you had AM, you should continue to use AM. For those of you who had Illinois Student Transportation, we are in the process of attempting to identify additional providers. The good news is the new performance standards do not give us a 30-day limit on when bus evacuations have to occur for the first one. We have a little time to work with. We're working very diligently to identify companies.
Does the partnership agreement needed to be given to all PI families until the development of their goal? The partnership agreement. We'll get back to you on that. Actually, if you can just kind of give us a little more information about this question, that'll help us decide how we will answer that. But we'll definitely get back to you on that.
The next EDPD meeting is tentatively scheduled for Thursday, November the 16th. but please watch the CSD e-blast for confirmation
And location.
and location. If the family income changes during the program year, which changes their eligibility, example, moving from private pay to PFA, PI, or Head Start, early Head Start, do we need to change the program model in COPA? Yes, you do. You will need to change the program model in COPA as the child is being deemed eligible for PFA, PI, or early Head Start and Head Start.
And just to clarify that, you would actually terminate the children's wait list and change the program model on the waiting list. You don't just go in and change the program model as the child's enrolled. So you would have to go through the process again of moving them to the waiting list to redo their eligibility for the new program model.
You stated that there is a November 15th due date of 50% completion of one service in family engagement. What are the services that need to be completed? Well, the services that need to be completed is really based upon your family. So, for example, if you have a family that comes in and says, I need help with food, I don't have enough food to feed my family. So if you guys provide, the site provides that family with a referral to the nearest food bank or maybe even WIC, and then the family follows up on that and gets the information, that's a service that's completed. So it's completely based upon what's needed for the family. Does PI home visiting have to meet the licensing and square footage requirements if we are only providing socialization groups? So again, because we had a couple of, so we want to get you guys the correct information, so we'll get back to you on that. We have about 1 more minute left to answer questions. Do we need to add screening data in COPA for PFA and PI? Yes. You enter screenings under the developmental in COPA. Okay, thank you, Kim.
For clarity, what hours are considered the program hours?
For clarity, what hours are considered the program hours for Head Start, Early Head Start, PFA, PI? That's another one of those questions that we want to make sure we get you the correct answer for, because I can make up something, but you don't want that. And this is probably going to be the last question. What needs to be included in the partnership agreement for PI families? Is the partnership agreement developing goals for families? Yes, the partnership agreement is developing goals with families, not for them, but in conjunction with the family. It is based upon what they need and what they say. And also, for a partnership agreement, what needs to be included in the family partnership agreement for PI, we'll definitely get back to you on that piece.
Okay, so now we're going to wrap up. We're looking, there are not any more questions. So please be mindful of the CELS training that will be rolled out either later this month or in November. Note that there will be some upcoming trainings for the release of the enrollment and HR manuals, and COPA site-based access meetings will be held on October 30th and 31st. And so look for more information in the CSD updates. Now, your executive directors and your program directors receive the CSD updates. So you may want to give them a little nudge or a little reminder to say, hey, did you get that CSD update from DFSS? because they are responsible for making sure that that information is trickled down to you as part of the external, internal communication process. Thank you so much for joining us on this webinar, and we will be in touch real soon. Have a great day.
Bye.
Bye.